An update on a story we first brought you back in July. A Trinity Health home care location closed today in West Springfield, resulting in the layoffs of dozens of their employees.
Western Mass News reporter Paris Dunford joins us live in studio with reaction from the healthcare community. Paris.
Chris, Mary, about 60 employees lost their job today from this closure. One local healthcare worker says she's confused since home health care is needed now more than ever. Back in July, Trinity Health announced they will be closing their at-home healthcare and hospice agency in West Springfield, affecting Western Mass patients and 60 employees who have now been laid off. Western Mass News reached out to the company for a statement. President and CEO of Trinity Health at Home, Mark McPherson, says in part, quote, "The COVID-19 pandemic has changed the business of healthcare forever. While we expected and planned for the changes a global pandemic would bring, the negative impact and lasting effects are much greater than anyone imagined. Nationwide health systems are experiencing broad shifts in patient volumes, staffing challenges, including high-cost agency contracts, and increasing supply and pharmacy costs." Its statement goes on to read, Trinity Health at Home is addressing these challenges with long-term and short-term solutions so that we continue our mission of caring for the many communities who depend on us. After considerable thought, we have made the difficult but necessary decision to close our Massachusetts agency, including both home care and hospice, at Trinity Health of New England at Home. The president of the Massachusetts Nurses Association, Katie Murphy, says she's shocked and confused.
Communities need these services, and hospitals are closing them down.
She says the patient volumes mentioned in the company's statement is accurate, but she says that's why agencies like Trinity at Home Healthcare are needed to take some pressure off the hospitals by providing care at home.
People who delayed care during the pandemic are coming into the hospital sicker than ever. Hospitals are bursting at the seams. It doesn't seem to make any sense from that point of view.
Plus, she argues that staffing challenges are exactly why the company should not be laying off 60 employees.
Many hospitals are saying that they don't have, that they have unfilled positions, and Trinity is laying off 60 nurses, 60 healthcare professionals. I'm sure they are needed someplace.
Murphy tells us hospitals received funds to help deal with the COVID-19 pandemic. She believes those funds could have prevented this closure.
This is good, might be better for their bottom line, but it is not better for the community. The community needs these services.
Now, the company says those who did lose their jobs are eligible for a severance package that includes pay, medical coverage, and other benefits. Current patients could complete their 60-day care plan. If their needs go past those 60 days, their services will be transitioned to a new agency. Reporting live in studio, Paris Dunford for Western Mass News.